Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, everyone. Today we have our student Jay Mehta, who's a Sarthi student. But the good thing is he has done about 8 US clinical experiences. So we want to sit down with him, understand what his perspective is in terms of differences that he may have seen from India, in terms of cultural and medical environment differences, in terms of logistics, how he's managing his stay, cost-wise and everything else. So with that, let me welcome you, Jay. Thank you for your time. Appreciate it.
Hi, Pawan. Thank you so much for introducing me and inviting me for this interview. So I'm Jay. A brief about me, I'm Jay. I'm a recent graduate from India, and I've been pursuing my rotations for my internal medicine residency match for this season, which is 2025. If I have to give a few tips on what to expect from a rotation, specifically this goes out to students who just start their rotations. First things first, you don't have to know everything. Just if you are whatever specialty you're rotating at least know the basics. So as of me, as an internal medicine applicant, I need to know the basics of certain bread and butter cases of medicine. So hypertension, diabetes, management, not everything, but yeah, at least be ready with the basics of this. The program director or anyone you're rotating with don't expect you know everything, and this is why you have rotations in the US, to learn the system, to get familiar with their methods, and that will basically help you as you go forward in the rotations. Because mind you, you are rotating that at 4 weeks, and if you just know everything on the first day, trust me, the rotations aren't that fun. You won't learn anything.
So that was a good thing, right? What to be prepared for as you come into the rotation. So this was the kind of medical side of things, in terms of your knowledge base, etc. What are some of the other differences or things you have seen, whether it is cultural, that students coming from outside US should be prepared for, or otherwise? What are some of those things?
So the first cultural shock that I got coming to the US is everyone is so friendly. Like irrespective of medical students you're rotating with, irrespective of it's a resident, attending, or even a program director. Like I'll give you one example from my experience. My first rotation, I went into the rotation, and an attending came into the ward, and I was actually with a patient. And as an response, I was like, "Yes, good morning, sir." And the first thing he said, like, "Please don't address me as sir. Please address me as doctor and the last name." So I hope it's difficult to get used to it. I still sometimes make that mistake, but just be very calm on your first rotation or any rotation that you go to. Everyone is there to help you. Everyone is really friendly. But again, don't get too personal with them. Be a little professional. Show some professionalism. Show some dedication. But yeah, I think that would be my advice to the students. So address them as doctors, but also do not get too personal with them.
What are some of the other differences you may have seen, whether it is patient communication, attending patient communication, bedside manners? What are some of these differences?
As of bedside manners, I would say that here, as in the US, the care is very patient-centric. So if you want, so what I personally do is I communicate with the patients a lot. I first try to connect with the patients on the personal level, and only then go forward to the disease or ask about the symptoms. That is something that I learned from one of the residents that I rotated with. He used to be very cautious about all this stuff. So he So the first thing that you should consider when coming to a rotation is make the patient feel comfortable, because you might be or might not be a fluent English speaker. You might not have the accent and they find it difficult to understand you. So the first thing is reassure them, comfort them, and then go on to present or take histories. So that's something that I found different from my home country rotations.
Okay. So now some of the other questions we get, right? How do you manage your cost? What is day in the life? How do you cook? Do you not cook? Logistics. And I know all of this would be different in different cities, but you've done 8 of these. So some tips on these things.
All right. So irrespective of guys, girls, whoever comes, learn how to cook. Trust me, it helps a lot. My first 2 rotations, I didn't know how to cook. As soon as I went back home, the first thing I told my mom, please teach me how to cook. So if you are coming to the rotations and you want to manage your expenses and you don't want to spend a lot on DoorDash, Uber Eats, or go out and eat, because remember, in the US you have to tip. So if you go out to restaurants and eat, you are spending that extra money on tips. So to avoid that, I learned how to cook and I spend most of my money on groceries. It's not that I don't eat outside. I do when I go out with friends, or sometimes I just feel tired after the rotation. So I do order some food, but yeah, it's prudent that you learn how to cook. And in terms of transport, that's a big question that even I got from a lot of students that I rotate with. Always before you start your rotations, Google public transport in the city that you're rotating. So as of me, for example, you have something in Michigan, something it's called SmartFlix. So these are basically cabs that function in a very specific parameter, and it can drop you from one place to another in as low as $2, which can be $45 in Uber or Lyft. So always look out for public transports. If you're in big cities like Detroit, Chicago, New York, the public transport, including the buses and the metros, are wonderful. You can make use of it. And one more thing that I would take care of is before starting your rotations, know the address of your clinic or the hospital wherever you are rotating at, and look for the places to live nearby. So I would recommend Airbnb. Facebook Marketplace is a really good place to look out for rentals, and there's Furnish Finders. So these are the places that I look out to. It might be expensive because these are really good areas, as they are near to the hospital. So these are considered like prime areas, but it does save you money on transport. So you got to balance it out on either spend money on transport or money on rentals.
Okay. One more question or observation that I have is a lot of IMGs initially are very shy or reticent. They don't know how to engage in a conversation, tits and bits about weather, sports, whatever. How have you picked up these things? Be more friendly conversationalist, whether it is an attending, program director, or other fellow trainees with you.
So as of attendings and program directors, as I mentioned before, the first thing is that barrier, like the seniors, he's our program director. We need to be very careful for what you say. Break that. So he's a person, you are a person. Although he's more knowledgeable than you, doesn't make him superior to you. So just be as you interact with him, be friendly. Like if you introduce yourself, hi. So for example, hi, I'm Jay Mehta. I'm starting my rotations with you. It's really nice meeting you. Be interactive. I know it's very difficult. Trust me, it is very difficult. But as you do rotations, you'll get used to it. The other thing that I find it difficult, found it difficult when I started my rotations are the accent. So I still have an Indian accent. People do catch on it, and people who start rotations still will have the accent with their thing. Uh, just just be free. Don't afraid of it. People don't even care about your accent unless they understand what you say. Even if you have a broken English, that's fine. Most of the patients understand it. most of the hospital staff understands it, most of the residents understand it, and everyone started there. So just don't be afraid to speak out. And what I used to do is I generally prefer walking to the place that I rotate to, because that gives me a chance to interact with people outside the hospital. So if I walk by, there's someone walking across me, I just say, hi, good morning, how is your day going? So that random communication that breaks the barrier for the day, and now you feel more comfortable interacting with anyone in the hospital. So I think you should find at least one person in the morning to break that communication. It might be a roommate, like you just bumped into him in the kitchen and is like, hi, good morning, how are you? That's it. That's all you need. And I think that helped me overcome a lot of those phobias about communicating in the US.
Excellent, excellent. All right, now let's get into specifics of some of the rotations. So currently, I think you mentioned you are in Detroit with Dr. Rua. What's the day in the life in a typical rotation? What do you do?
So I actually rotated with Dr. Rua and one more attending physician. So usually from Mondays, Tuesdays, Thursdays, and Fridays, I'm at the clinic, seeing patients, presenting cases, and with me there are three more medical students, I would say, but like in my IMGs that rotated with me. So we always have plenty of patients to present cases on. So go into the clinic, just be myself for the day, take histories. The doctor comes in, present the case, and discuss the treatment and the further plan. On Wednesdays and Saturdays, we actually have didactics with Dr. Rua. So these are basically online didactics, but she gives us the topics or the questions to prepare a day or two prior to this. And we prepare a presentation and basically present on the topic. So the questions are more clinical than just presentations. So that basically helps a lot with understanding the case scenarios, and everything goes in the flow. So it just gives you a really good idea about, how it starts with like pathophys about the disease all the way to the treatment. And each of the student gets one topic to go in depth for. So yeah, sometimes Dr. Rua also shows up at the clinic, and we see patients with them as well. So all in all, it's a very interactive and a very busy rotation that I'm here with.
Okay. What about some of the other rotations? Any different experiences?
Um, actually, one of them I distinctly remember is I was at last month, I was rotating in Chicago. One patient came in with like really severe back pain, and she's like screaming out loud. She just barged into the clinic. It's like, I'm in severe pain, please help me. And everyone, because most of them, it was their first rotations, they didn't feel comfortable to like control, like, manage her, because she was in severe pain. So I didn't know how to do it, but I took the initiative, like, please come into the room, how can I help you with? So that is what it is. Like, if you know how to break the barrier, you can calm the patient down. So I calmed the patient down to an extent that now I can take the histories from her. And that basically, I think, helped make an impact with the physician that I was rotating with. So he's like he actually like got out of the room and he says, Jay, good job. Like, and that's all you need. Like, that is what I say. Like, you don't need to know everything when you come into the rotations. The only thing that you need to know is communicate and be friendly with your patients, because again, as we are used to back in India, like, patient-centric care is very rare. But here it's all about the patients. So if the patient says no, it's no. If the patient says yes, it's yes. So just be effective with your communications. Try talking to as many people as possible. Introverts, I understand, I'm one, but you gotta break the ice. So I think that is the most memorable experience that I have in all my rotations.
Wow. Excellent. Thank you very much, Jay. Anything else that we missed?
Um, I think budget,
Okay.
if we could. Yeah, I mean, as I said, like cooking, public transport. The one thing that I would stress on about is is if you are on a budget, I guess for a 4-week rotation, I usually keep around like $1,200 as my budget. And so back at home, I used to splurge. Like I didn't have any, accounts for what I spend on, what I do that. But once you come in the US, once you're on your own, you actually start managing those budgets. And another thing that as food, so why I tried cooking is because I'm a vegetarian. I can't eat meat, so it's certain areas it's difficult. If it's major cities, you find food. So that is why a strong request to everyone, like, irrespective of guys, girls, whoever you are, please learn how to cook.
Good. Thank you very much, Jay. Appreciate it. This was very, very helpful, and I'm sure will really assist all the students who are coming here for rotations.
Thank you, Dr. Paul, for helping.
Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.